future doctors! Ever wondered how your heart keeps beating non-stop? Let's dive into the magic of coronary arteries. Your heart, a powerhouse of non-stop action, needs a constant supply of oxygen and nutrients to stay alive and kicking. This crucial job is handled by the coronary arteries, which originate from the base of the aorta. First up, the left coronary artery, or LCA. The LCA splits into two main branches, the left anterior descending artery, or LAD, and the circumflex artery, or LCX. The LAD runs down the front of the heart, supplying the anterior part of the left ventricle, the interventricular septum, and often the apex of the heart. It's nicknamed the widowmaker because it supplies a huge portion of the heart muscle. On the other hand, the circumflex artery travels around the back in the atrioventricular groove. It supplies the lateral and posterior walls of the left ventricle and the left atrium. In some people, it even supplies the SA node, the heart's natural pacemaker. Next, the right coronary artery, or RCA. The RCA supplies the right atrium, most of the right ventricle, and parts of the left ventricle. It's also responsible for supplying the SA node in about 60% of people and the AV node in 80 to 90%. The RCA gives rise to the posterior descending artery, which supplies the inferior wall of the heart and the posterior interventricular septum. Now, here's a critical point. The coronary arteries are end arteries, meaning they don't have a lot of backup routes. If one gets blocked, there's not much room for rerouting blood flow, making the heart vulnerable to ischemia. But what about the veins? The heart's venous drainage is primarily handled by the cardiac veins, which follow the coronary arteries. The major veins, including the great cardiac vein, middle cardiac vein, and small cardiac vein, all drain into the coronary sinus, which then empties into the right atrium. Here's something unique about coronary circulation. It's affected by the cardiac cycle. During systole, when the heart contracts, the coronary vessels are compressed, reducing blood flow. Most of the coronary blood flow happens during diastole, when the heart is relaxed. Understanding this intricate blood supply is key for diagnosing and treating cardiovascular diseases like coronary artery disease. Blockages can lead to a heart attack if blood flow is significantly reduced or blocked. Thanks to advances in medical imaging and interventional cardiology, we can now visualize and treat these obstructions more effectively, improving patient outcomes. So, there you have it. The heartbeat behind the heart's beat, the coronary arteries. Keep these in mind as you continue your journey in medicine. Until next time, keep your hearts healthy.